Hi, I'm Dr. Mary Yost, chair of the Undergraduate Nursing Co-op program at Drexel University. So what sets our program apart? We show it every year with our incredible NCLEX pass rates. So we are above the national average continuously, and we are in the top 3% of the state with graduating large numbers of students at the same time. I think what makes Drexel different, especially in the nursing program, is the faculty that we have. I work with the most amazing group of faculty members. Most of them still practice, so they're able to bring their real life experiences back to the classroom. We have clinical faculty that are actively practicing, so when you're working with them at the clinical site, they are up to date, they are competent, they are already experiencing everything that you're experiencing. They meet with students continuously to support one-on-one Zoom sessions, review sessions, anything that the students need. The faculty are there for them. While we have the co-op opportunities for students, that definitely engages them and gets them in the practice area. Other areas that we offer are the real life experiences that students get when they do clinical. We use clinical throughout the city of Philadelphia. So you have experiences in level 1 trauma centers, teaching institutions, but we also go out into the suburbs, also New Jersey, Delaware. So the experience that you get is across the continuum of care with a variety of settings so that you get a little bit of everything. We have the Student Nurses Association, the largest in Pennsylvania, so students can travel to national and also state conferences. They presented posters for the College of Medicine and actually won, and it is amazing the work that they do. They bring proposals forth that they can then take to our State Board of Nursing. Also at the national level, they can present proposals that they want to work towards to make nursing better, to make patient care better, so they can see the legislative side of being a nurse.